A partial shutdown of the federal government is interrupting the flow of food assistance to needy people in Illinois, and big changes are in store for people who rely on Medicaid for their health care. How do those affect state government here in Illinois? We'll talk with one of the General Assembly's leading policy experts on this edition of Capital Cast. Hello, and welcome to another edition of Capital Cast, a regular podcast of Capital News Illinois. I'm Peter Hancock. One of the biggest challenges facing Illinois state lawmakers these days is keeping up with all the changes and disruptions at the federal level. That's especially true when it comes to health care and social service programs like Medicaid and the Supplemental Nutrition Assistance Program, or SNAP, which involve partnerships between the states and the federal government. State Representative Anna Moeller has been deeply involved in all the changes happening in those programs. Moeller is a Democrat from Elgin who chairs the House Appropriations Committee that oversees health and human service programs. I spoke with Representative Moeller on Wednesday of this week to ask her how the state of Illinois is responding to the recent suspension of SNAP benefits and all the changes about to take place in Medicaid. Here now is that interview. Representative Moeller, thank you for being here.
Oh, it's my pleasure. Thank you for having me.
So you chair one of the House Appropriations Committees, specifically the one that oversees funding for health and human services programs. These have been much in the news lately. A lot of these programs are either jointly funded by the state and federal government, like Medicaid, or they're federally funded but administered by the state, such as SNAP, the Supplemental Nutrition Assistance Program, which has been much in the news. I wanted to talk first about the SNAP program. Because as we record this on Wednesday, November 5th, we are still in the midst of a partial federal government shutdown. We're now in, I think, the 36th day, making it the longest one in history. One of the things that has happened is that SNAP benefits have been suspended effective the first of the month, but then two federal judges have ordered the administration to use emergency funds that will at least partially restore funding for this month. Wondering if you can tell me how has this affected state government? I know that your committee held an informational hearing during the recently passed fall veto session.
Yes.
How has this affected the state government, and how are we responding to it?
Well, let's just be clear. The cuts that are being contemplated and were approved through the authorization of H.R. 1 at the federal level are going to be devastating here in Illinois and are a major threat to the programs that millions of our residents rely on, either through Medicaid or through SNAP. And our state government, as you mentioned, these programs are either a partnership with the federal government. In the case of Medicaid, it's a 50-50 partnership where the state pays half and the federal government pays half for health insurance costs for those on using the Medicaid program. And for SNAP, this is a fully federal program, but administered through the state. And with the recent actions of the Trump administration, in particular with SNAP, vowing to not send funding for the SNAP program to the state of Illinois, we were looking at 1.8 million Illinoisans losing access to SNAP benefits. And as a result, Governor Pritzker authorized through the Department of Human Services to allocate about $20 million, roughly $20 million to our major food banks to provide that additional support, knowing that many Illinoisans not having access to November SNAP benefits were going to be in need of extra nutritional and food assistance. So that's the first immediate step that the state has taken to help address the lack of funding for SNAP benefits for November.
Well,
But long
I did want to ask about that because not all Illinoisans live just down the street from a food bank or other kind of charity. I mean,
uh,
do
yes.
we really have the infrastructure to fill in the gap there? Just with that $20 million going to those kinds of programs?
So SNAP provides nine out of, or food banks provide 1 out of 9 meals to people who are in need of food or have food insecurity. And that's under normal circumstances when SNAP benefits are being provided. So no, it's not going to be enough to be able to meet all of the needs that are out there for people who rely on SNAP to meet their food needs for the month. But it's something that we can do immediately to help shore up the demand that's going to be out there. And certainly we're calling on average residents who may be able to contribute to help provide donations to food banks to help out their neighbors who might be experiencing additional needs right now because of the cut and the delay in SNAP benefits being distributed to residents. But no, this is not going to be able to bridge the gap created by the federal government suspending those payments.
So another aspect of this that I think maybe a lot of people don't necessarily think about is that there are grocery stores and other merchants located in low-income neighborhoods that receive most of their most of their cash business is done through SNAP benefits.
Yeah.
So it's not only the people losing the access to that cash, but it's also the businesses that rely on that flow of money. Have you heard much from those businesses? Is there concern out there about how they are being affected uh, by the shutdown?
Yeah, I mean, we know that SNAP provides an economic benefit of about $7.2 billion to our economy through the purchase of food and necessities through that program. And that goes right back into the businesses and the stores that you mentioned. Also, trickles through the economy, supporting jobs that people who work in those businesses. So it's not just an economic hit and a devastating blow to people who rely on this to feed their families. It is also going to be an economic hit to our small businesses and those who provide those food, who sell, who provide those services to people who are on SNAP. So yes, it's going to have a much broader economic impact in the state.
Okay, more broadly, I wanted to ask some of us are old enough to remember the first federal shutdown during the Clinton administration in the 1990s. There have been several since then. Are we getting to the point where maybe do state governments need to start doing something to buffer themselves against, the sometimes radical shifts in federal policy from one administration to the next, or these intermittent federal shutdowns? Do state governments need to do something to kind of protect themselves against these upsetting events?
Well, in regards to the SNAP, what we've just experienced with the SNAP benefits being suspended for the month of November and the Trump administration, wanting to withhold those funds for the near term. This is something that's unprecedented in the 60-year history of SNAP, regardless of the administration, and regardless of the shutdown. SNAP benefits have always been paid by the federal government. This is the first time in history since SNAP has been around that an administration has used these benefits as a political tool or as leverage in a shutdown, which I think is reprehensible to use hunger and people who need access to food assistance as a cudgel in a political fight in Washington. But certainly it does send, messages to state governments that we do need to make sure that we have the resources or at least a minimum safety net in the event that these types of actions or decisions are made at the federal level. And over the past several years, here in Illinois, we've passed balanced budgets that include rainy day funds and contingency funds to help us get through emergencies. But certainly we don't have the resources at the state level. No state has the resources to fully make up for the lack of federal participation in these programs. And so in the near term, we're doing the best that we can to make sure that we're protecting people in our state, the people who need it the most vulnerable, seniors, children, veterans, people with disabilities. But we don't have the resources at the state level to fully make up for the loss of federal funds.
Well, you raise an interesting point about the rainy day funds. I'll just ask, is this a rainy day? Is it raining outside right now?
It feels like it. It's been feeling like that since the Trump administration took office back in January.
Well, I
It's
mean,
been one.
specifically, has there been any thought or discussion about tapping into the rainy day fund in order to meet the demand, meet the needs for this unique situation here?
Well, I think at this point, as I mentioned, we're looking at the immediate need of getting food assistance to our major food banks with the $20 million that we included with the Department of Human Services, knowing we've got 3 more years left of this administration, and who knows what's on the horizon, whether it's economic instability because of the tariffs or other measures that are taken at the federal level. We need to be careful with how we spend those funds. We need to be prudent in how we're managing our own budget. But I think we're trying to do the best that we can right now with the resources that we have to protect people who are affected by these decisions coming out of Washington.
Okay. I wanted to shift gears now and talk a little bit about Medicaid. You mentioned that Congress passed H.R. 1 earlier this year, otherwise known as the Big Beautiful Bill Act. And I'm not being partisan there. That is actually the official name of the bill that was signed into law on July 4th. Big changes to Medicaid, specifically a work requirement for some Medicaid recipients. This is the jointly funded health insurance program for low-income individuals and families, for the disabled, pregnant women and children. It covers about a quarter of the state's entire population because eligibility was expanded under Obamacare, or otherwise known as the Affordable Care Act. So how are these work requirements going to affect people in Illinois, and how is the state getting ready to implement that?
Sure. Well, just to be clear, already and under our existing program, we have most Medicaid recipients already do work or are attempting to work and provide for their families through employment or other types of activities. For those who can't work, it's because they're taking care of a child or a disabled family member, or they themselves have a disability or some reason that makes it difficult for them to work. So that at the beginning, these requirements appear to be very arbitrary and not necessary. In states that have required work requirements, we've seen a drop off in recipients from the Medicaid program. Arkansas and Georgia were 2 states that implemented their own work requirements on their Medicaid program, and 97% were compliant or had exemptions, but still lost coverage. And the reason for that is because uh, having to continuously certify and fill out paperwork and go through the bureaucracy of proving that you have a job or that you're gainfully employed can be a big burden on Medicaid recipients. And it can be a deterrent for people to sign up for Medicaid in the first place. So it doesn't do much to actually incentivize people who otherwise could work. It is a disincentive even for people who are working to sign up for the Medicaid program. And we heard testimony in the Human Services Appropriations Committee last week about this. People, it's in some ways we're requiring people to work before they can access health care is kind of the opposite approach that we would want to take to make sure that people can work. People need health care in order to work. And so denying access to health care coverage because someone doesn't have a job actually makes it harder for them to become gainfully employed because they're not able to manage maybe a chronic illness or not able to get treatments that they might need to make them healthy enough to get a job. So in a way, it's a harmful and counterproductive requirement that the federal government is now putting on families.
Okay, well, it is a requirement nonetheless, though, at least for the time being. And I think if I understand correctly, states have to turn in their implementation plan by mid-year in 2026,
Yeah.
and you have to actually implement the plan after December 31st, so start of 2027. I'm
Right.
just wondering, what steps will the state of Illinois take to make sure that people aren't inadvertently dropped off or disenrolled from Medicaid because of the work requirement?
Right. So our Department of Healthcare and Family Services, the agency that oversees Medicaid, is already developing plans and processes, procedures to make sure that people are not falling off the program unnecessarily, using technology, using lessons that we learned from the COVID-19 pandemic, to make sure that we're getting out to all of the people who are currently enrolled in Medicaid to make this an easier process for them. And I think we do have experience in making where the state went through the redetermination process a couple of years ago after the pandemic to re-enroll recipients back onto the Medicaid program. We used our MCO partners, our managed care organizations who administer the Medicaid program, using them as partners in reaching people, community-based organizations, all of our different networks that touch people who are in need. They're going to be, utilizing all of those channels to make sure that people understand how to enroll and to make the process as easy as possible. But this is also going to end up, this is an additional cost, an additional burden for state government as well. We know we're going to have to hire additional employees and utilize additional technology in order to meet this requirement. And so we're going to be paying for a larger bureaucracy to administer the program, and money and funds that could have gone to help pay for care is now going to go into bureaucracy to implement this federal rule that, as I said, doesn't really make a lot of sense from a public policy perspective if you're trying to get people covered with health insurance.
Okay, well, ostensibly, these provisions are being put in to reduce the overall cost of the Medicaid program. This was a budget cutting measure. Are you saying, is there going to be a net savings from this, or is it actually going to end up costing the state more?
The savings is going to come from people just not having access to health care, which I think is a huge tragedy. We know that mortality rates increase. The higher percentage we have of uninsured people in our state, Our hospitals are going to have to pick up the burden of taking care of people who don't have access to health insurance. We're going to see more emergency room visits. We're going to see people with chronic illnesses that were not able to manage their illnesses early on get worse, which makes providing care even more expensive and more devastating for people who have these chronic illnesses. So I don't see this as saving the federal government or the state government money. It's going to end up costing lives and costing and shifting the cost of providing that care to emergency care and late stage care for people who are not going to have access to preventative care anymore. So overall, it's not. It's a net negative.
Okay. State Representative Anna Moeller, thank you for being here.
Thank you so much for having me, Peter.
That was State Representative Anna Moeller, chair of the House Health and Human Services Appropriations Committee. And this has been Capital Cast. Capital Cast is a production of Capital News Illinois, a public affairs reporting project of the Illinois Press Foundation, with funding from the Robert R. McCormick Foundation. I want to thank our videographer, Andrew Campbell, for coordinating the video portion of this episode and getting it up on our YouTube page. Until next time, on behalf of the entire Capital News Illinois team, this is Peter Hancock saying thank you for tuning in.